Communications Director for the South Dakota Department of Health. Thank you for joining us for our daily COVID-19 case update briefing. I'm joined by Dr. Joshua Clayton, State Epidemiologist, and Kim Malsom-Risden, Secretary of Health. Dr. Clayton will provide today's update, and then we will take your questions. I'll turn it over now to Dr. Clayton.
Good morning. As of today, we are reporting 92 new cases of COVID-19 in the state. This does include 109 new recovered, 588 new negative tests that have been performed, 6 new hospitalizations, and 0 new deaths. In total, that brings our case counts to 4,177 COVID-19 cases in the state. Of those, 1,108 are active infections and 3,023 individuals have recovered. We have 333 total hospitalizations as well as 46 deaths, and in total we've had 26,212 total negative tests that have been performed. For the community impact map, we have no update. And for new cases by county, we have 5 in Aurora, 25 in Beetle, 6 in Brown, 2 in Buffalo, 1 in Fall River, 4 in Gerald, 4 in Lincoln, 3 in Lyman, 17 in Minnehaha, 4 in Oglala, Lakota, 11 in Pennington, 1 in Sanborn, 1 in Turner, 6 in Union, and 2 in Yankton. For new cases by age range, we have 14 in the 0 to 19 year age category, 26 in the 20 to 29 year age category, 14 in the 30 to 39 year age category, 12 in the 40 to 49 year age category, 15 in the 50 to 59 year age category, 8 in the 60 to 69 year age category, 2 in the 70 to 79 year age category, and 1 in the 80 and over category. For new cases by sex, we have 55 that are male and 37 that are female.
All right, thank you, Dr. Clayton. I'm unmuting the lines, and we will take your questions.
Yes, JP from KORN News Radio.
Go ahead, JP.
Thank you very much. First of all, can we get an update on the Smithfield numbers, Demcota and Aberdeen, and if you have any information on Dakota provisions as of yet regarding new cases?
All right. So we have 841 of the 853 Smithfield cases have recovered. 245 of the 245 close contacts to those Smithfield cases that have recovered. Demcota, 84 out of 128 cases have recovered. And for Dakota provisions, we have less than 10 cases. And so we typically refrain from discussing specific employers unless there is a risk to the public or ongoing cluster. And so that again, has not been established for a lot of the other businesses within the state. And so just a point of clarification that while individuals work for specific employers, as we have a very small number of cases, that doesn't mean that there is a risk of infection specifically within that employer. So just realize that as we have additional questions regarding employers come up, we try and not talk about cases associated with an employer because there's not a determination that that's where the exposure occurred.
Thank you.
We'll take another question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
The U.S. Health and Human Services announced yesterday that the state is going to be receiving about $58 million for testing and contact tracing. And just wondering if you can talk a little bit about where that money will be going towards.
Lisa, this is Kim Malsom-Risden. So we are working on that right now, and certainly the funds will be used to support some of the mass testing that we're doing that we even, started and announced last week, starting with nursing homes and assisted living, moving on to congregate living, partnering with tribes to do some mass testing. And so we know that the funds will, really help us with that. The funds the expenditure period for those funds is over, I believe, the next 30 months. So it will be an extended time period that will have those funds available to help us with our response. The contact tracing aspect will also be part of that budget, and that's the process that we use once we get a positive test to follow up with individuals. Obviously, we've been surging that capacity, and so there's costs associated with that as well.
Next question.
Ben with the Daily Plainsman in Huron.
Go ahead, Ben.
Yeah, I have a question, and I understand this is regarding employers, but we just this morning got confirmation from LSI in Alpena that they have numbers. They wouldn't give us numbers. We have confirmation from employees there that it would be more than that 10 threshold that you had mentioned. Where are you at as far as, I know we talked about this yesterday, Kim, at the press conference. At what point does the state step in to do a mass testing regarding waiting for the employers to request it?
So this is Kim Elson-Rice, and when we see cases of employees, we do work with employers to understand if there might have been exposures to other employees. And in the situation where we are seeing more than, a few employees at a particular employer, we have an assessment. We have a team that is available to work with that employer. Depending on kind of the sector of the employment, we have some different assessment tools that we work with them on if they're interested, things that they can do to minimize COVID exposures in their work sites, things that they can be doing proactively with their employees to help with that. And so we also have the availability of going on site and doing some on-site visits to help, with that assessment process. And then we also have technical assistance to help with mass testing if that's where that employer wants and needs to go. And we've got some guidance around that as well.
Next question.
Okay.
Next question.
Well, if nobody else will, JP from KOI News Radio back again.
Okay, JP?
Yes, I see that we have 5 new cases in Aurora County. Are those considered community spread?
So this is Dr. Clayton. So we're still in the process of investigating those cases, and the determination of whether or not they're community spread will likely be reflected in tomorrow's update.
Thank you.
Yep, thank you.
Next question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Just wondering if you have a number of how many cases total came from the Smithfield mass testing and how many of those have recovered?
So we don't have a breakdown of the specific number as it relates to Smithfield employees, but what we can say is that about 24% of the individuals that were at the testing event, which obviously included Smithfield employees, their family members, and other household members, were positive out of that total testing volume.
Next question.
This is Joseph Barkoff with the Capital Journal.
Go ahead, Joseph.
Thanks. Good morning, y'all. So a couple things going on. I was just kind of looking for, I guess, an explanation. Like, one thing is, if you look at the numbers, it seems most of the counties that have numbers, most of them are above 20%. If you do positive, or, all the cases versus how many are tested, it's about 20%, which is about, I guess, can you comment, is that what you expected to see? And then with all the tests bringing up like small numbers, but positive in all in a larger number, handful of counties than there has been in a few days, maybe a week or more. Is that like? I assume you're still only doing, the CDC testing guidelines where, with the expanded symptoms and so forth. But like, is that just from people getting sick and the symptoms are expanding? Is that kind of like JP was saying? Is that, community spread? Is that, maybe you need to do another stay vigilant quote for me? I don't know. I'm just like, are the numbers supposed to be what they're supposed to be? And then also, won't it be a little bit skewed when you start getting the mass testing of all the old folks' homes? You know what I mean? Like, because you'll hopefully have just a crap ton of negative tests, and won't that like skew the numbers for? Do you know what I mean? Like, there's just some things going forward. Sorry for babbling for so long, but it seemed like a slow day.
Yeah, so, again, this is Dr. Clayton, and one of the things that I would say is that anytime that you're taking on a testing event where you are including individuals who are potentially asymptomatic, that definitely has the possibility of skewing the numbers and any percent positives that you would have out of a testing event like that. So, that's obviously an area that is something that we are trying to monitor and are trying to identify, where and when those mass testing events are occurring. Some of those are, starting. Some of those have been underway at various scales of testing, tens of individuals to, some of the events that we have coming up are testing hundreds and even thousands of individuals when you look at that long-term care facility area. So, yes, that we do anticipate that the mass testing will impact both our total number positive, our total number negative, and that percent positivity. And then as it relates to the number of counties kind of where we're seeing cases, the focus, is that we are seeing more cases in more counties than what we've really seen in recent weeks. And so, that's an area that I think we want to continue to monitor to evaluate what is the focus of whether or not some of those cases are community transmission or whether it's due to a direct link to an existing case, and that's why they were tested. With the number of individuals that we have that are currently symptomatic and all of their contacts that are actively being monitored by the Department of Health, you would expect that some of those individuals would be testing positive or would develop symptoms and would then test positive. And so the numbers that reflect our overall cases within some of those counties, may be reflective of those that are considered close contacts as well as those that are community acquired, and keep an eye on the community impact map to better have an understanding of where those numbers are and what sort of risk is in each of those counties.
Next question.
As a quick follow-up, so if you find that like people are perhaps being infected, though it community spread like from some of the smaller counties when they go out. I realize you guys aren't going to friggin' shame any business. You're not going to shame any individual with like this person, but will you make an announcement that, hey, we have found cases where people have gone out and come back and brought it from community spread from other places to small, like, will you guys ever say anything like that?
So when we're looking at transmission, the focus is that we don't know exactly where they acquired it, whether that may have been community transmission in their county or in an adjacent county that they may have traveled to. What we do is make sure that when we identify those community-associated cases or community spread cases, that that's reflected in the community impact map.
Next question.
Ben with the Plainsman here again.
Go ahead, Ben.
Question on the community spread, just with the LSI confirmation today, with their plant happens to be located in a place where we've seen some jumps with Gerald County having a jump today, Sanborn County has had a number of cases in the last week, and then Beetle has really exploded in the last week. And all three counties really supply the employers or the employees to that one plant. Where would you see a potential, where would that spread be designated if it were to be designated due to employees from that plant, is what I guess what I'm trying to ask.
Well, if we're identifying a specific business as being the potential source for a lot of the transmission, it would not be reflected on that community impact map, but it would be, obviously part of our ongoing investigation and work with a business. And so, that's information that's not, readily published to the website, but and it's not treated necessarily any differently than a smaller employer that has maybe 2 cases. But there was no potential community transmission. We wouldn't do a public notice in those instances. It would be really a focus on that containment by notifying those who have been exposed in that work setting.
So Ben, this is Kim. Another way to say that would be that community spread reflects cases where we cannot identify a known source. So that's how that gets reflected on the map.
Final question.
Thank you.
Last call for a question.
This is Kelly Hertz from the Preston Dakota.
Go ahead.
Okay, about a month ago, this refers to Beetle County, actually more than a month ago, and it was pretty quiet for a while, and I asked whether county's community spread status, which at that time Beetle was considered substantial, and asked if that status might ever change because of its really being quiet, and I think the Secretary of Health said that would probably not happen because of the infectiousness of the disease. But then on April 29th, the county was downgraded from substantial to minimal. And on May 4th, it was taken off the community spread list overall completely, and now it's just exploded back. So is there any thought of maybe changing the criteria for downgrading counties on this community spread labeling process?
So I think that's a very good question for me to address, and this is Dr. Clayton. So, the criterion that we use, I think is appropriate, and there again, we have the opportunity to continually reevaluate, but we want to be really reflective of the situation on the ground. And so, we move from that substantial to the minimal to moderate transmission when there are no active infections within a county, as we feel like that represents a lower risk, to the general population. And then, rather than using just 14 days, which is the maximum incubation period for the COVID-19, maximum time from the time a person was potentially exposed to the time that they would expect to develop disease. We actually double that and use 28 days. And so there is that long transition time from the minimal to moderate transmission to no community spread. But you are exactly right that, when we have cases, and sometimes those cases come fairly rapidly in succession, that we want to be able to ramp that back up to represent the level of risk within the community. So we have a longer tail of taking communities off than we do of ramping them up to bring them onto that minimal to moderate or substantial transmission.
Okay, thank you.
All right, thank you all for joining us this morning, and we will visit with you tomorrow.